It's very hot outside. If you're Nigerian, you can already relate. It's very uncomfortable. If you're pregnant, then you should be concerned. And this is why. Several studies have linked extreme climate conditions like heat to pregnancy complications such as preterm births. I came across this group of amazing researchers who presented a paper on heat pregnancy in South Africa. And I think there's a lesson or two to learn from it. Come with me as I talk to them. Nigeria is very hot. Africa is hot. The world is hot. Heat affects pregnancy. How does it affect pregnancy? If you're pregnant, if you know someone who is pregnant, this video should be of interest to you. So, hi guys.
Hi. So today we spoke about heat and climate change, but heat specifically in South Africa and how it influences preterm birth rates. We looked at various aspects of it from specifically informal settlements, the climate aspect of the changing temperatures, as well as the issue of preterm birth rates in general in South Africa. And we brought the two together to see that it actually is really related, and there's a ton of epidemiological evidence that associates the two. And then we also introduced some interventions.
A couple sort of easy behavioral, individual level lifestyle changes that we can recommend are even just things like more cautious of being in the shade, and water and wearing like loose cotton clothing can be really beneficial, as well as if you're able to shift your work hours to be working during off-peak heat times, that can also be very beneficial. And a bit more long term, we found a lot of evidence of painting the roof of your house white and that having a big impact on the internal heat of your house.
So we identified a range of pathways that heat affected women that are pregnant and in their contraceptive period. And we identified risk factors including substance abuse, previous infections, including HIV infections, chronic medical conditions, and then mental health conditions, as well as the age. So we had a variety and collated a variety of surveys that were both qualitative and quantitative in nature. And things like age were risk factors, socioeconomic inequalities were risk factors, as well as educational status and the situation in which people lived. So those informal settlements that we highlighted. And then specifically to Nigeria itself, although we focus on informal settlements in South Africa, we are aware of informal settlements in Nigeria, such as that in Makoko, which was recently established for bulldozing. And we were recently queried by one of our facilitators about how to establish interventions in this region when they might not be present for the next 5 years to come. And we have recognized that such schemes that do want to resettle people will take a lot of time, which is why we've highlighted more short-term interventions that people that are living with the problem of their pregnancy in this current day and age can affect and can manifest right now.
To talk more about the biological mechanisms, there's been a growing interest in looking at the placenta specifically in terms of how heat can affect the mechanisms. For example, one of the studies that have been shown on animal models have linked epigenetics and heat, and this can cause plethora of issues, all of which result in placental dysfunction. There can also be changes in DNA signaling pathways and also hormonal disruptions, and these hormones are important for maintaining pregnancy and promoting fetal growth.
I think something quite basic and that we highlighted a lot in behavior change and antenatal education, because that is an area where we're already trying to get moms to come in, to book early, to have their 8 appointments. And I think that is an excellent place for education of moms, and even the mother care book, where you've got your partogram, you've got the history. You can just add in an extra page in there and honestly just say, this is what happens when it's hot. And there's another app that was actually made by a group of people at LSHTM called Mother Heat Alert. And it's a free app, and basically it tells you when it's getting really hot and what you need to do.
For a basic understanding as well, the government should initially recognize that climate crisis is impacting everybody and is unfortunately impacting some vulnerable groups more disproportionately. And even here in Europe, we only have about 5 countries out of the whole of Europe that have recognized climate resilience as a factor to be considered in maternal and perinatal healthcare. So just registering that it's a problem that needs to be addressed, and for this vulnerable population, is step 1. Then step 2 is recognizing that particular population in our case, South Africa, but in Nigeria too, is step 2, and then giving them the help that they require, that they need, and for a longer term as well.
This topic is still very young, but still limited. But it's very important, okay, to protect the pregnant woman from to more exposure from heat. So that's why more intervention have to do quickly and to strengthen the system as well.
In South Africa, in isiZulu, we say
Ukushisa
Ukushisa Kakulu.
It's very hot. And if you're pregnant, here's what you should know.